the most important aspect here when we try to build these futuristic models of AI in medicine, in having what we sort of calling swift bias, is basically having a way where this system would be aware and tell us that they're already biased and propose what we need to do, for example, gathering or augmenting our data with more from a specific group because they're really lacking this in the system. Patient data and privacy, this is something we all know, but if we think again about how the systems would have access to this data for the continuous training of the models and being able to solve these new tasks, this means like this data will always be accessible, and we need to make sure that's protected, and we can protect all the patient privacy. But also when you think about deploying this as well, this is something that is very important. Scaling. If you think about scaling model, which we now have seen like models that come up with billions of parameters, right? How this is work for this even more sophisticated model? How do they have an impact on the environment as well, generating substantial amount of CO2, but also from the other side, the data. Like now to build this, you need to have like a more diverse data that basically need lots of bodies to get together to build these large databases, data sharing initiatives. And we have seen some examples at the UK Biobank. And on that briefly, there's also like in Qatar, where I'm now like a Qatar Biobank. So there's such a similar initiative. It's ongoing. They currently have 40,000 participants with also genomics, imaging, electronic health records. So I think we start to see these initiatives globally was good. Hopefully the next step will be how all of these biobanks work together to get like this massive amount of data in one place to be used to build such systems. Deployment, again, as mentioned, will be challenged. These larger scale models having access to all of this data. Shall we move the data to one place or use like federated learning approaches where the data can stay in the place, and also like being able to build our new AI capabilities? So all of these questions that still we don't have an answer to, but we're hoping like this at least like would be our futuristic solution or getting towards like this general AI in medicine and healthcare.